My name is Kay Kirkbride. I'm the president of the Board of Directors for Hospice and Palliative Care of Washington County. And I'm one of the founding members of the hospice.
I'm Jerry Gibbs, and I'm a physician. I'm a medical oncologist, and I'm medical director of Hospice of Washington County.
As an RN, I had experienced dying people, and they were absolutely miserable in the hospital. They were crying out in pain, and they were agonizing over what was happening to them, and we didn't know what to do with them.
I remember in the early 80s, people would spend much longer time in the hospital. They could spend weeks there, and they would commonly die there. They might be admitted to die. But if you ask the patient, the person, they'd rather be home.
We didn't allow the families to be there with them because of the strict visiting rules. And so I thought to myself, there has to be a better way.
There is something about cancer that most doctors don't want to deal with. And it was obvious to me that these people didn't deserve the abandonment. So that's why I decided to be involved here. These are really nice people.
I got into the organization a little later after the group had gotten together to honor Marianne Nimmo. As we know, she was a young woman with several children who was dying of breast cancer.
And she taught us a lot about what it was like to be a person with this problem, to desperately seek a solution and then finally accept that life's not forever.
And she gathered her friends about her and said, you know, we really need to have a hospice in western Washington County because the closest one was in Portland. And so her friends developed that dream of hers, and we got together and decided that we would put together a hospice. And so 5 of us, myself, Cam Camburn, Val Ivy, Rita Hull, and Cindy Hull, went for 8 weeks into Portland at night to take lessons on how to start hospice.
The nurses are remarkably competent. And they've seen people die before. They don't mind. They see it as a process. They want it to go well.
And during that journey, which took several years, we had help from Citicorp, we had a Fred Meyer grant, and we had a very generous grant of $60,000 from the Tuality Healthcare Foundation to go after Medicare certification. So in 1990, we had Medicare certification, so we finally had arrived after several years of working together to develop the hospice. And of course, one of the requirements of Medicare, and rightly so, is that we have a medical director. And Dr. Gerald Gibbs, Dr. Gibbs was a natural because he was a local oncologist, and he already had helped us in some of our teaching and some of our advising of how to put the hospice together, and he had a real interest in it. He and his wife Shelley have been great during all of these years. We rented a house from them where our office was for a long period of time. They were very generous with allowing us to be there, and so they've been great supporters of our endeavors all these years also. After 5 of us went into Portland, we developed our first volunteer training, and we had a lot of people eager in the community. In fact, our first class was 32 people. One of the ways that hospice is unique within the healthcare system is we really use volunteers, and they serve in a variety of ways. Many of them are what we call direct care volunteers, and they're willing to go into patients' homes and to sit with them while the family takes a little rest, or maybe goes out and runs some errands. We couldn't do it without volunteers. They're just wonderful people.
You can know many people. You can know people for a long time and not really share much, not really know them. But this is where life is real. This is what's really important. Yeah. And possessions, money, status doesn't matter. We're all the same. We're all alive till we're dead. And we're all equal that way.
The heart of hospice remains the same. To be very caring to people, very supportive, and allowing them to do what it is that they want to do at the end of their lives. So it's a privilege to have served these many years with hospice, and I hope there's going to be more.